And also with each voice devices comes a sound. It's either strategically designed or it's natural functional sound. And especially in healthcare, there are a lot of sounds considered unhealthy noise. So I want to know, based on your knowledge and learnings from the sound design community, how should brands think around designing their voice user interface?
I love this topic as well, because this gets into sort of, well, sound and music and all this sort of stuff. And I'm a musician as well, so I love this. There's this whole area now. No, I shouldn't say now. It's been around for decades, but it's got a lot more attention now. The whole idea behind sonic branding and what that means for brands, but also healthcare environment. Everything has a sound, and it's really important. It's really important that people start to think about, what does your brand sound like? Not what does your brand look like? Because a lot of people can say that, my brand is about this and it's about this, but what does your brand sound like? And I'll give you some examples in healthcare. When you walk into a hospital or you're walking in a ward, very often you're going to hear like alarms going off all over the place, like these buzzers and these these harsh sounds, beep beep beep, and all this kind of stuff. And it's not a very relaxing environment as far as the sound goes, right? There's so much that could be done in terms of designing what you hear when you go into one of these environments to make it much more relaxing. Like I was actually, I think it was on another podcast, we were talking, and we just started brainstorming about this, and we realized, like, imagine if instead of all these medical devices making these harsh beeping, buzzing sounds, they were all actually like nature sounds, but they had some sort of meaning to the nurses and to the healthcare providers. So instead of walking in and hearing all the beeping, you're walking in and you almost feel like you're in like a forest, but those sounds have meaning to the nurse. Like, why not? And what would that mean for the patient in terms of just being in a relaxing environment? They feel, they close their eyes and they rest, and it just sounds like they hear some water running or some birds chirping. And the birds chirping might mean, nurse, come check on this medication. But, that's the kind of thing that if you really think creatively and innovatively, I think it can be quite magical. The other thing from a more practical aspect is brands do need to think about, like I said, what do you sound like? So what's your persona? What kind of voice are you going to have? Is it going to be a very like official sounding straight voice? Or are you going to try to have your voice be more conversational and, more sympathetic and this sort of thing? So those are all the types of questions and things that people should be thinking about in terms of what does their voice sound like.
It's very interesting. It goes again with the human. How are they thinking of the beginning? Because a lot of people say, but we don't have a sound. But you do, because your device has a functional sound, right? And
Yes.
They say, but we don't want to focus on delivering on that. Is not in our budget. But at the same time, well, you have a sound that's giving an unhealthy experience and a stress and long-term negative effect for the patients. So it's never been like it's probably a lot of research out there, but I don't think it's enough for brands to understand that it has a negative effect. It's not about just about, oh, we are pushing them to do audio branding to have audio branding. It is actually because of a purpose of a health.